everybody, to this week's episode of Compliance Deconstructed. I'm your host for today, Jessica Zeff, and I'm accompanied by my good compliance colleagues, Lorie Davis and Elvan Baker. Today's episode, we're going to talk about fraud, waste, and abuse. So what's the difference? What is it all about? And we keep hearing out in the public all this talk about fraud and the administration cutting back on fraud. And actually, Lorie and Elvan and I were talking about this and wondering, well, wait a second. We know about fraud. We also know about this thing called waste and abuse, but actually, what's the difference? And how is this the same or different than this fraud thing we keep hearing about in the public? Am I on the right track, Elvan, Lorie?
Absolutely.
You got it.
So
Let's
what are
talk
your
about it.
concerns? What are I'll talk about fraud, but we were a little bit worried about people throwing around this use of the word fraud. Like, what's going on? Why are we worried? Does everyone have the same conception of fraud?
I think that's just it. Every congressional hearing since January, they've talked about it in whatever order. It's not always fraud, waste, and abuse. Like we all say, sometimes it's waste, abuse, and fraud. Sometimes it's abuse, waste, fraud, and vice versa. But they talk about it so much. I think it's important to set the baseline and set the tone of what it is and why it matters.
I think in our popular culture, we use the word fraud to mean something that is not genuine and fake, and as if, I feel that is being used very much so in that regard. However, when we put it in the context of compliance, it just does have a different meaning, and it's not as cutesy as being a fake. It has different connotations.
Yeah. So, for you compliance folks out there, speaking to your colleagues, working with your organizations, maybe even working with clients or patients or other stakeholders, and for those of you who are maybe just listening in out of curiosity, we're going to go through what fraud really means for those of us working in compliance. And we're going to talk more about waste and abuse and how these are similar and different. And one of the reasons we really wanted to go through this topic is because number one, there's a popular maybe misunderstanding about what fraud really means, or maybe there are multiple interpretations. So what does it mean actually in the context of our profession and what we do? But also when we talk about the administration and this talk about fraud and what the administration is trying to achieve in terms of minimizing fraud, how is that definition changing even within the work that we do? Is it really changing, or is it really just kind of enforcing what the fraud laws and rules have always been about anyway? So I think it's important for those of us to really explore that conversation and that meaning. So I'll give a little bit of a kickoff, and we'll talk about maybe the textbook definition of what fraud really means. So if you look it up in a dictionary, the definition of fraud is going to go something along the lines of knowingly and willfully executing or attempting to execute a scheme to defraud a healthcare benefit program or to obtain something of value through false or misleading representation. Okay, so that's a lot of words, right? But things to really pay attention to about fraud. And this will be important in the context of waste and abuse. So fraud is willful. You have to know you're doing it, intentionally do something wrong, intentionally lie, intentionally misrepresent, right? With the aim of receiving some sort of benefit, right? So some examples in healthcare could be, and we read about this all the time. Lorie and Elvan and I could go through enforcement. If you read enforcement actions from the Department of Justice or the Office of the Inspector General, you see fraud all of the time. And you get some really good examples. But for today, a few examples, very common, billing for services that were never provided. So healthcare providers or home health or chiropractors or dentists, all of the above, billing for services they never provided and submitting claims, for example, for office visits or procedures that never happened and then getting paid for them. Or something called upcoding, where I don't know, for those of you who aren't familiar with healthcare or healthcare compliance, whenever a patient goes in for treatment or service, right, the provider uses certain codes to label the service or the treatment and then submits that code to Medicare, Medicaid, or a health plan in order to get paid, right? The code represents a certain treatment. But upcoding means you maybe submit a claim for or a bill for a service that maybe will attract more money than what you actually provided. Okay. So that you can make more money. So you're not really charging for the service that you provided. You're charging for a more expensive service that you never provided so that you can make more money. So, for example, billing for a complex patient visit when they might, the patient might have only had a wellness check, right? But the complex visit is going to bring you more money as a healthcare provider than maybe your run-of-the-mill wellness check. Or another example of fraud is kickbacks or bribes, right? Accepting or offering a payment, for example, for a patient referral. That's fraud, but it's also a violation of the anti-kickback statute, which we'll talk about another time. And then there's one that Elvan, Lorie, and I have seen quite often, unfortunately, but just falsifying records, not keeping the right documentation, intentionally not keeping the right documentation, or changing documentation to justify unnecessary procedures or even meet prior auth requirements. I know once Lorie and I were involved in an investigation with a nurse who was literally falsifying patient visits to their homes. And I can't remember at the moment how we caught it, but there was something. It might have been copying the same notes, even though they were different patients. And Lorie and I got wind of it, and we thought, this is a bit strange. They're two different patients with two different needs. And on further investigation, the records were completely falsified. So those are all examples of fraud. So remember, fraud is about intentionally committing a wrong or misrepresenting information so that you can benefit financially, right? And that happens quite often, I think, in a lot of industries, but healthcare, because of its complexity, has just seems to be have a lot of opportunity for fraud. So, but that's one piece of fraud, waste, and abuse. I'm going to hand over to, was it Elvan?
Me? All right.
Yeah.
First,
Are
I
you
have a
covering
question for
waste?
you.
Okay.
Actually, I have a good question for you. What is your opinion about, because fraud, for something to be considered fraud versus waste or abuse, you have to have that intent. Intent requires knowledge, right? How about blissful ignorance?
Oh, I think that's a really great question, actually. And I would say, though, that the laws require a lot of them. You'll notice the language known or should have known.
Should
The
have known.
individual knew or should have known, should have been able to reasonably anticipate there was fraud.
Correct.
So blissful ignorance really doesn't work. There's
And this is
still
my little plugin for the practitioners that are out there, clinicians who are putting their license numbers, their signature on those claims. should have known applies to you. That's a part of our bylaws, state bylaws, where we are licensed. It is an expectation of our education that it's a reasonable expectation that you should have known. You should have suspected, you should have looked into it, and you should not have turned a blind eye to it. We see that pretty frequently in my world, where the clinician might say, I didn't know. I understand, and my rebuttal usually is, I understand that factually you did not know that what was happening is considered fraud, but you were expected to have known. I believe you did not know. I believe the truthfulness of that. However, you should have known. That was the expectation.
And that's a really great point to make,
Mhm.
actually, because there's no such thing as, oops, I didn't understand. I
Mhm.
really didn't know. If you look under false claims and a lot of the enforcement action, what I would say to you is, if I was working on the other side as an auditor or an assessor, is
Mhm.
I'd say, well, why didn't you know?
Mhm.
Like, what systems didn't you have in place? Do you not have someone looking
Mhm.
at compliance? Do you not have an external party checking for you? Like, why didn't you know?
Mhm.
This is
Mhm.
something you should know. And you're never going to have like a false claims case that says, oh, we won't charge you for false claims, or we won't take that money back because you just
Mhm.
didn't know. Like, it just doesn't work that way. The response that you'll get is, well, why didn't you know?
Mhm.
You
Mhm.
really should have known about this.
And we understand, they're going to look at it, they're going to say, okay, statistically, we understand I didn't know part in case or example or incident number 1, 2, 3. But then we have all these, cases, because there is a natural learning curve to everybody's clinical life. But, that's when things go from being a one-time incident to intentional statistical value that happened over and over and over again. And okay, where were you as a clinician then? Not realizing, not knowing, not paying attention. Yeah. Anyways,
And
I
I
had to
think,
put that plug in.
no, I'm glad that you did, because actually it brings up another good point. There's a difference in order to be, convicted, or
Mhm.
to, well, I'll say convicted for the moment because I can't find a better word, but to be guilty
Mhm.
of an act under the False Claims Act, right? You don't need an intent. We're talking about fraud, waste, and abuse, and those definitions. But actually, to find yourself in a bit of hot water under false claims, which any of these, you can find yourself in trouble for violating the False Claims Act. That doesn't require fraud with intent.
Mhm.
It requires not knowing and just
Mhm.
getting it wrong. Think
Mhm.
about your taxes. I mean, I hate to bring up taxes because everyone hates taxes, maybe even more than compliance. I don't
Mhm.
know, but it scares me. But think about the IRS. And if you didn't file correctly, or you didn't claim because you
Mhm.
didn't think you had to, and they come to you and they say, hey, you should have claimed, or you made this mistake, and here's the penalty. And
Mhm.
you go, oh, I'm so sorry, I didn't know. Do you
Mhm.
think they're going to turn around and say,
No.
okay, you're excused, we're good, we're
No.
fine? No,
No.
they come at you and they just say, well, the rules are the rules, and here's the
Mhm.
penalty. This is what we want to happen next. So the same thing happens under false claims. You don't necessarily need fraud, but fraud is very specific in that it additionally requires not just the wrongdoing, but the intention to do
Mhm.
wrong.
Mhm. Intention to do wrong and intention to gain something out of it. And it's rarely the goodwill that people are trying to gain out of these things, that they're trying to, the intent to gain something usually is financial, right?
Do you want to know, though, when I was a kid, I know this is taking us a little bit away. This isn't maybe an unusual story, or maybe people don't talk about it. But I knew of a dentist. In fact, it was my family dentist, and went to him for years. He was the nicest guy. But one day when I was older, I found out that he'd gone out of business. And I found out why. He was actually committing fraud. But what he was doing was he had patients who could not afford to get dental treatment. And his rationale was that if he upcoded, if he billed for more complicated procedures that he wasn't performing, he could then use that money to
Ugh,
provide dental care for those who couldn't. So he totally did wrong. Like, I totally get it. But you made a comment about rarely do people do it for a good cause. And that's the only time in my life where I've come across it. Doesn't make it right,
correct.
but it just triggered a little memory there
Mhm.
of how he was using that money. So it does happen. But to be honest, it's still a false claim and it's
Mhm.
still fraud.
And
You know,
ultimately, it
although
hurts
he
the
might have
system in
had
the
his
long
heart,
run. Yeah,
yeah,
I
he might
mean,
have had his heart in the right place, but it's
mhm.
still fraud and he still got into trouble. So does happen if anyone was looking for, a tiny bit of a silver lining. I'm there for you. I'm trying. All right,
It does
Elvan.
happen. It does happen. All right, I'm going to take over and talk a little bit about the waste part of the fraud, waste, abuse. When we talk about in the context of fraud, waste, and abuse, waste refers to the overutilization or inefficient use of the healthcare services or the resources that usually result in unnecessary costs. The definition of waste is pretty similar to the same thing that we all do with our grocery shopping.
You
You
do
buy things,
tell.
yeah, you buy things. There is no malintent. I'm going to use that word. You buy things with the good intent of using them, but ultimately you never do, and it meets the bottom of the garbage. Now that $2, $5, $10, that's a complete waste. You might as well take in those dollars, twist it, and put them in the garbage. So healthcare waste within the context of fraud, waste, and abuse is the same thing. Or you go buy a more expensive item for the same recipe that could have used a lesser expensive item. It's just your recipe is calling for a simple middle of the road garlic, and you go buy this garlic that there's a special garlic that's called like elephant garlic, and it's this blackened and aged. And I mean, the poor recipe just called for a garlic. Now, instead of $2, you paid $22, and here you are. It just tastes the same thing. Nobody in the family can tell. You're just out $20. So it is that, but ultimately it does lead to, because it's within the context of healthcare compliance. When you do engage in this wasteful behavior, and it does cost the system more money, and it usually involves some misrepresentation, it does lead to a violation. A good example of waste is the patient comes, a child describes a simple fall when they were riding their bike and their arm is hurting, they're holding it. And instead of your first option, which is a simple x-ray machine, you decide to go with an MRI scan. The cost is tenfold. So now, instead of utilizing the x-ray machine, where you would have gotten the child through the system, by the way, faster, a decision would have been made faster, they are sitting waiting in the ER room for 6 extra hours to utilize a more expensive diagnostic machine. And all that happened is that there is a simple fracture. It could have been diagnosed with an x-ray 6 hours ago. Now we have the ER visit cost plus the MRI machine's cost just to come to a simple diagnostic that would have, that could have been done a lot faster, easier, cheaper. That's a really good example. Another great example is that, in our country, we have generic medications and brand name medication. We all know that by FDA approval, they have to meet the same result giving properties, right? So instead of using the generic medication, you intentionally prescribe the brand name. Now, if that's a case of the patient request and there's a medical necessity, that's different. We're not talking about that, but we're talking about the case where, very, very popular right now, the GLP-1, instead of the generic brand compounded semaglutide, you go with Ozempic. Again, it's just being wasteful. Basically, to me, it's the easiest one to explain because everybody understands the word waste. Because we were all raised with the discipline of don't be wasteful, and it's just as that. What is so different from fraud? Like Jess explained, the intent. Fraud involves more of the intentional deception for usually a financial gain. Well, I understand that your family dentist was kind, but he still benefited financially. Or abuse that involves practices that are inconsistent with the accepted standards of care. That still also leads to unnecessary costs, but they're below the accepted standards of care. Waste often stems from lack of oversight. Somebody's just not doing enough looking into it to understand where is the pool leaking from, basically. It's just, it involves poor planning, poor operations, systemic issues that could have been looked into that just wasn't done. Yeah. So that's waste for us within the context of fraud, waste, and abuse for me.
So I find it interesting that you say, waste is like an easier concept for people to understand, because I'll be honest, I've really struggled with it. It's of the three, fraud, waste, and abuse, waste is the one I have found to be the most difficult to describe until right now. I love the way that you use the example of shopping. I think a lot of people can relate to that. I certainly, as soon as you said it and you made that analogy, I wish I had had that analogy earlier and I would have used it in my training. I think, at least for me, and Lorie shaking her head, yes, it makes the concept actually very concrete. And I have never been able to use such a great example so that other people could really understand. So I'm so glad you shared that example. I've never heard anyone use it before, and I will be using it going forward.
I have many
I
examples. I have happy hour examples about waste. I
Ooh, okay, all right. Offline, I want to hear the happy hour one, but the shopping one is absolutely brilliant.
Yeah,
I'd also
absolutely.
Oop,
Go ahead.
go ahead, sorry.
No, absolutely. I mean, I think, one of the things that I'm sure Lorie can agree with us on this one is that we talk about these concepts all the time. We expect clinicians to know about these concepts. It's a mandatory requirement that they're educated on it. We want consumers to understand. We want them to be educated on it. But then some way, somehow, these are some of those concepts that's like somebody written something on the cloud and it sits above us and it doesn't affect us. And if it affects us, we don't know what it is practically. And that's just your kitchen budget is the perfect example for it.
It is.
And we all do it, and that's the thing, we all do it.
So, could I ask
Yeah.
a question, ladies? We've all been to the doctors, or we know people who have, right? Um, so and I think the three of us are caregivers in one way or another. We either have children or we're caring for someone who needs some additional support. And I know we've all been here where you have different, maybe providers ordering the same tests. They're not sharing information. They're putting you through again and again the same thing. Is that considered waste? The
Do
issue
they know
is,
about each other?
yeah, they're all part of it. They have access. They may not have access to the information, or they
Yeah.
don't want to use it. So I've seen
Mm.
situations where you give them the data, you give them the report.
Yeah.
So, for example, blood test. You know, I am with my phlebotomist provider more times than I care to be. I know them all on a first name basis because the doctors involved in my care, like they don't trust the results that I just got 1 week ago. Or another one might be an x-ray. Like that's a
Mm-hmm.
really great one. I don't understand that either. But why is that considered waste as well?
Hmm.
I
Lorie, you
wonder.
go first. I have a good example to give for my personal life.
Yeah, I think sometimes it's the problem of the EHR, right? The electronic health record. Here in our greater metropolitan area, we have two health systems, and then we have a third that sits outside those two, and none of those EHRs talk to one another.
Hmm.
Sometimes you need to go to a specialist, and that specialist lives in one of those three entities, but they can't see anything from the other entities. So they order new tests, not because they don't believe the validity of it, but they truly can't see it. They've tried to contact that one of those other entities to get the record and they can't. So without
Hmm.
proper information, they're like, I don't know what else to do. Please go get this other test. I don't
Okay, I can buy into that.
I think it is wasteful just on some level, but I also think it's clinicians wanting to have the best, most accurate and up-to-date information. And if they don't have a good way of getting it, they're trying to make sure they have something to justify their actions. At least that's how I
Okay.
see it.
Okay, that's fair enough. That's a very fair example. How about the times, and I think this is why what we have regulations about coding, right? Certain things you can't code within a certain amount of time twice in a row, and I understand that. And there are certain results for blood tests that needs repeating because you need the most recent levels. I can understand that, but what I don't understand, and I think what Jess is concerned about, is the times where they're doing it. And I have seen this happen is because, we like this machine's reading better. Oh, okay. Same thing happened with my spouse. He had to get a testing within the same system, may I add. They didn't like the readings and they wanted this newer version of it, which when we asked, it was doing the same reading for his heart rhythm. They wanted it done again. Okay, then can you explain to us why? And when we looked at the medical records, there was a little bit more explanation as to why the second doctor could not agree with the first doctor's opinion of a specific single event. And I could tell that he wrote that there with the intent of explaining why something of the identical thing is being ordered 2 weeks in a row, back to back. Basically, one of them was using it as a diagnostic. The other one was using it not just as a diagnostic, but a decision of what the next procedure should be. So
Okay. So not a clear answer,
no,
but
I
that's
don't think
okay.
so.
I
Yeah.
think there's risk there, but whether
Mhm.
that can be avoided under the current
Mhm.
circumstances, who knows?
Mhm.
Okay.
Yeah.
I've
Yep.
had this happen also where I don't know why we're coming up with the dentist today, but I changed dentist
We love you,
and
dentists. We
yes,
really do.
when I changed dentist and I said, okay, where can I get my records sent? Even the new dentist office said to me, they will only send X part of it. And I said, well, how about this part, that part, that part? And they said, no, that's not considered a part of your record. And I'm like, well, that's a part of my mouth that we're talking about. And I have it
Oh
with me.
no.
And lo and behold, they don't have to send that portion of the records where you have to get new x-rays at the new doctor's office, which was very surprising for me to learn that that's the case. I would like to argue back that my mouth doesn't change that quickly over the course of 6 months, but they said apparently that's
They may
the
have had a
case.
misunderstanding. Let's talk offline. And
Mhm.
eventually we'll do a podcast around HIPAA and patient records. Not today, but we will get there. And
All right,
dentists,
Lori.
we do love you. Just remember that.
Lori, take it away
All right,
about abuse
Lorie,
before we just, this
we've
is
got
runaway train here
Yeah.
with our
No,
personal
no. Good
examples.
stuff.
abuse. We got
All
good stuff.
right. So, rounding out the last one is abuse. And abuse refers, and again, this is per our friends at CMS, that refers to practices that may not be intentional fraud, but typically are inconsistent with accepted medical or business practices that can result in things like unnecessary cost, improper payment, payment for services that are not medically necessary. Excuse my English. One of the things to keep in mind with abuse is it's always inappropriate behavior or billing practices that don't meet those standards. And Elvan, you had said that a few minutes ago, even if it's not clearly fraudulent. So that's an important distinction when you're thinking about the Venn diagram of fraud, waste, and abuse. That's where kind of it lines up. Some important examples is billing for services that aren't medically necessary. So, keeping in line with our dental theme of the day, if you go to the dentist, they want x-rays and they seem to want x-rays frequently. Many insurance carriers have standardized how frequently those x-rays can be taken and be reimbursed. So it's important to think about that. Or, you're getting an excess of treatments or injections, so to speak, for an ailment. Another example is improper coding or billing practices. So you bill the service. So if we're at the doctor, instead of a standard annual care or physical, they bill for an intensive code. So that could just be as easy as reversing a number or putting a 6 instead of an 8. So it could be more careless than not necessarily trying to be fraudulent. And then a third example is excessive charges for services or supplies. So if I think about home health, a nurse coming to your home, they could have an hourly rate and someone is billing with an extra 0 at the end. And again, it's not necessarily intentional fraud. It's someone trying to do something very quickly, or they've got a large number and so they're doing something like that. Or if I think about orthotics or PT, you may need to get a brace and that brace could only cost $40, but when they do an upcharge, that $40 turns into $400. So you can see how abuse can quickly add up in dollars. And it's not always malintentioned. Sometimes it is truly, I'm writing very quickly, I add an extra 0, or I add a 6 or a 5, or when I'm writing a code, because sometimes when you go to the doctor, they've got those nice standardized forms that have the codes already pre-printed, but sometimes they don't. Sometimes it's smaller clinicians, they're literally writing on a piece of paper or, their pad, and you're handing it to the biller or the receptionist, and those things happen. It's human error, but it's important to call that out in that Venn diagram. When I think about fraud, waste, and abuse, I always think about it as a Venn diagram where there is some level that it always overlaps. But I think intent, it's sometimes abuse is willful. They know they're charging you 10 times the cost of a brace, or they're upcharging you for an injection that you don't need. But sometimes it's not. Sometimes, just your earlier example where we talked about, I need to order you to have another set of vaccines because I can't see on my side if you've had this vaccine. So sometimes it's having the patient's best interest at heart and lack of evidence. They don't know what else to do, but they want to help the patient. And so this is what they order. Meanwhile, that patient's had that same vaccine 6 times now, because, which is a whole other conversations about electronic health records and interoperability, which I'm super excited to talk about in a future episode. But today, bringing it back to fraud, waste, and abuse. But I guess thinking about that, how do we segue that and make it into something meaningful to the average person listening? Because these are all the things that we're thinking about when we hear these three words, but our friends in Congress and the president and his administration, when they're talking about it, is this what they're thinking about?
And that's a really great point. I think I told you guys both when we were prepping for this. When I went to the Healthcare Compliance Institute a few weeks ago, there was a talk from the Office of the Inspector General, and it was an unusual talk. It was somber. We're used to having
Mm,
people from the OIG come and speak. They tell us what the priorities are, what the highest risk areas are that we as compliance professionals should be looking out
mm,
for in the next year. And this was a really different conversation. There wasn't any of that. It felt like more of a scripted kind of conversation. But the big takeaway, and that frightened all of us a little bit, was that the current administration is looking at fraud a little bit more widely, to say, okay, well, it's not just about submitting a claim. It's not just about maybe your documentation not being up to speed and then that leading you to make claims
mm,
and getting paid for services maybe you couldn't substantiate. They're looking to say that fraud is, any kind of non-compliance with any kind of requirement
mm,
in the healthcare space. So if you say you're HIPAA compliant and you turn out not to be, that's fraud. If you say that you're going to conduct clinical supervision and you don't, that's fraud. So anything can now be, you say you're going to conduct an audit program and you never do, fraud. Because although the word is that, we were told the Medicaid and Medicare budgets would not be cut. That was a very clear message.
mm,
But we were also clearly told that the definition of fraud would be broadened and that money would be recouped where appropriate, where there's this idea of fraud. So I think the I don't know how exactly this definition of fraud and how we think about it today. It may still evolve a little bit. We don't know. It may be in flux, but I think certainly up until now, this
mhm.
idea of fraud, waste, and abuse, there's a lot of confusion. I don't think we do a great job as an industry to teach the
No.
difference between the three. And it's important to understand. And for those of you who are listening in and who are unfamiliar with the terms, at the end of the day, the intent of having this discussion really is to raise awareness of where we might go wrong, where
Mhm,
money could be lost from the Medicaid program, from the Medicare program, from healthcare in general, that could be better used to
mhm,
provide higher quality patient care and to maybe make healthcare and patient care more accessible to others.
mhm,
Like, that's the bottom line. That's why these issues are so important. But really understanding how you could hemorrhage money, how you could lose money, and the different ways that it could happen is really key to understanding the risk and being able to address those risks. And also, it helps to understand, all right, if there is a problem, if something did get overlooked, or maybe there was real fraud, what are the liabilities facing us as healthcare provider organizations or health plans or insurers or whatever it is? What can we expect the enforcement to be, and then how do we recover from that?
Yeah.
So it is helpful for all of us, not just to understand the
mhm.
terminology, but to understand why are we having this conversation to begin with.
Yeah.
But I will say and we can maybe talk about this in another episode, for those healthcare providers listening in, be aware, pay attention to what's
Mhm,
happening in the around the conversations of fraud in the healthcare space. If you have any kind of government contract, in fact, be aware of fraud and how far that definition could be stretched in the future if you are not concerned about your compliance program and how you detect fraud or waste and abuse. If that wasn't something that came across your radar in the past, now might be a good time to review that risk and what that could mean for you under the current administration.
Absolutely. I have an exercise for us.
Uh-oh.
I'll give you a scenario and we decide if it's fraud, waste, or abuse. Okay.
Okay.
I think we can do this.
Okay. We got a few more minutes. We just
All
got
right.
a few more minutes.
So we have let's call it a physical therapist who goes, physical therapist, outpatient clinic, patients come to him. Pretty straightforward. He's
Okay.
a sole practitioner. Patient comes, it's 2:00. He says, "Hey, I'm just gonna use the bathroom. I'll be right with you. How about you go to room number 2?" Patient's in room number 2. 5 minutes later, the physical therapist comes in and, he starts talking about, how was your weekend? Oh, what'd you do? We went to the baseball game. They talk about the weather, as we call it. And then at around 2:45, the patient is done with the treatment. They still talk for another 15 minutes. So it's at the hour mark. Patient is done. PT is done. PT walks the patient out of the, clinic door and goodbye, and kind of like guesstimates the treatment time to be 75 minutes.
Oof.
Fraud.
I would have
Look at her,
said
she's like,
fraud.
"God."
But was it intentional?
How about if
Or
he
should have been?
billed
Should have been.
Yeah.
How about if he billed for, he kind of thinks to himself, well, we spoke about the weather. Really, the patient did not move at all. 15 minutes, talked about my daughter's glitter purse for another 5 minutes. Within that time, 60 minutes. He was in the room from 2 to 3. 2 p.m. to 3
Still
p.m.
fraud.
Ooh,
Still fraud.
fraud. I would have said still fraud. But question, and I think it's an important one. What if you underbill for services you provided, treatment or services you provided?
Mhm.
Is that still fraud?
It's misrepresentation of the actuality of the events. It's not wasteful because it's not going to cost the system more. However, on the back end, it might cost the system more because you didn't treat the patient to the extent that you should have possibly.
But what if you did, but you billed less than you were owed?
So it's
I
not
think-
waste for sure.
I think it's fraud because it's intentional.
Mm-hmm.
Yeah.
Got it.
It's all
It is.
about
It is
intent.
still considered fraud. It's still considered fraud, and goes back to those controls.
Mm-hmm.
Well, how come? Why isn't this being picked up? And if you could underbill, is there a potential you could overbill?
Yeah.
Yeah.
Right.
And the
So
system is still going to pick up.
And it could spill into waste because if you're underbilling, that's time that could have been taken perhaps for another patient or another
Mhm.
member, or you could have
Mhm.
been doing something else. So then again, back to my visual Venn diagram, there could be overlap there.
Mm-hmm. Mm-hmm. Mm-hmm.
it's a hard one, I'd say.
And
I have
you're
a hard
abusing
time getting
still
my head
the
around
trust
that.
of the system. Look at
Yeah.
it from an abuse. You're still misrepresenting.
Yeah.
So you're abusing your rights as a billing authority in that moment.
I could see that. I find it personally hard to get my head around it because I think, oh, well, you provided care and you didn't bill. Oh, well, there's still more money in the pot then to provide care elsewhere. But actually, it is considered fraud. Would love to hear, what any listeners think or any questions they might have. And on that note, we're going to have to wrap up. We've talked about fraud, waste, and abuse, and we're going to talk about it again in our next episode. Thank you, everyone, for listening. Thank you, Lorie. Thank you, Elvan. Couldn't do this without you.
Thank
Great
you.
job,
Take care, guys.
ladies. Bye-bye.
Tune
Bye.
back in. Bye-bye.